Hello, lovely students. Welcome back to Kirti Education and Immigration Services India. Today, we are focusing on an extremely important aspect of OET speaking subtest. This video is about utilizing your 2 to 3 minutes of preparation time effectively. And the task which I have taken for this video is from the official OET website, that is www.occupationalenglисhtest.org, and this is sample test 2. If you would like to have the transcript of this task, you will need to watch the video till the end. So let's begin with how to utilize this time. Now, when the interlocutor gives you the card to prepare within 2 to 3 minutes, you have to see what is the setting. Whatever you see and whatever you read thoroughly, you should picturize in your mind. You should imagine yourself working in a particular situation, in a particular department, because this is the role play, right? This is not simply speaking, it is a role play. You are taking a role of a nurse, right? So mentally assume yourself working in that particular situations. And for example, the patient is 80-year-old. Okay, even if the interlocutor is young like me, you should still assume that there is a lady who is 80-year-old. Okay, so predict the scenario, especially when you are talking to the third person singular. Okay, because many students make mistake about he and she. So if you imagine that there is a father or a mother with son or a daughter, you will not make this kind of mistakes. Okay, so my first suggestion is to predict the scenario, to imagine the scenario and picturize in your mind. Okay, secondly, you should read the task thoroughly and you should underline the keywords. Now, why to read thoroughly? To understand the task appropriately. So, what all things you need to understand? So, first of all, where you are, okay? Whether you are in a home of the patient or you are in a community health center, whether you are in a clinic, whether you are in an emergency department. So, you need to see the setting. Then read the scenario and assume yourself in a particular situation, as I have said. But you should also see that who is the patient, what is the age of the patient, whether you are talking to the patient or the carer. Do you know the patient already, or this is the first communication? You may also identify the disease condition, the problem of the patient, the feelings of the patient. Okay. Now, disease condition can be diabetes mellitus, whereas the problem can be high blood sugar levels. Feelings can be anxiety, right? So these all things are different, and you should read and understand. You should also highlight the keywords very carefully. The keywords are the words that will help you to understand the entire sentence. Okay, because once the speaking starts, you don't have time to go through all the sentences one more time. Okay, so you should underline the keywords only. Then you can also predict the possible responses that you may get from the patient. Okay, like if there is something about reassurance, you may predict that the patient will have some concerns about something. Okay, if you have the information like convince the patient, you can predict that the patient will be reluctant for something. Okay, so you may assume the possible responses you may get from the patient and be ready. Okay, be ready that where you are going to summarize the information, where you are going to ask more questions. Okay, or when you are going to give structure to your information, that everything should be pre-planned. Okay, I would like to share my screen so that I can better explain what I mean. And this is the task from the official OET website, and this is sample test 2. So this is candidate card number 2, nursing. So you have made sure that this is your task. Setting is children's hospital. Now begin yourself assuming in a children's hospital. You see the parent of a 3-year-old girl who has been brought to the emergency department because she has chest tightness, wheezing, and difficulty breathing. You are assessing her in triage and has just taken her vital signs. The child is not present for the discussion. So, what are things we can consider as a keywords? So, you are talking to the parent. Okay, you see the parent. So, definitely either mother or father. If the interlocutor is female, consider mother. If the interlocutor is male, consider father. Okay. So you see the parent of a 3-year-old girl. Now imagine the scenario that there is a mother with daughter or father with daughter, and this is the children's hospital, and that is also emergency department. Okay. Now, what is the problem of the child? Chest tightness, wheezing, and difficulty breathing. So these are the given symptoms of the child. Disease condition not yet given. It's not confirmed. You are assessing her in a triage. Okay. You are assessing in a triage and have just taken her vital signs. This is very important information. Here it is mentioned that you have just taken her vital signs. That means the introduction is over. You have already asked some of the symptoms like chest tightness, wheezing, difficulty breathing. You have already assessed the child and you have taken the vital signs. From this point, now you need to begin the communication. Okay, so be ready that you do not need to introduce yourself for this task. Okay, you may begin like something like, thank you for allowing me to assess your child. Now, before I explain regarding my assessment, I would like to ask you more questions because your first bullet point says ask more information about the child's symptoms. So you may predict that what you are going to ask, okay, once the communication begins, because sometimes you are prepared for the tasks so well, like you are too much into the preparation that when the interlocutor tells you to begin, you get stuck. Okay, so that should not happen. You should also be ready to begin the task in advance. Okay, so you have just taken the child's vital signs and the child is not present for the discussion. All right, this is very clear. Now find out more information about the child's symptoms. And this is a very comfortable test because what all questions you are going to ask is already mentioned into the bracket. So it will be very easy for you to start making questions for each of the given points, right? So it's a great support, I would say. So you may think that you are going to ask something like, I would like to ask you a few more questions about the child symptoms. Is that okay? And start making questions one by one. Second bullet point is about explore further relevant details. So this task is demanding you to ask more questions about the child. So that can be about the general health. So everything is mentioned that what questions you are going to begin for this, but you should be an active listener as well. Okay. And whatever responses you are getting, you may write down here some like duration. If the mother or father says 2 hours, you can write down 2 hours. Possible trigger if something you may start writing because when you will finish getting the information, you are going to summarize. So these first two bullet points generally are about information gathering, and next bullet points are about information giving. Okay, so when you finish taking the information, ideally this is the place where you need to summarize the information and you should be ready in advance to summarize. Okay, you should be ready that this is the area where I'm going to make a summary, not at the end. Okay, summarizing the task is the part of information gathering, so it should be here. Okay, so this point is about further relevant details. This is the area where you are going to summarize. Then the next point is about giving examination findings. So this is giving the information and you can predict that how I am going to give this information. Okay, you are not predicting any responses from the patient because here you are going to ask the question and this is going to be a dialogue because you will be asking the questions and the interlocutor will be giving you all the answers. Okay, but here once you summarize the task, you are the person who is going to lead the interview and moving towards the examination findings. Okay, and now you are going, what findings you are going to give is already mentioned. Then you are going to outline the next steps. So this point is about the next steps and it is the steps. So you should be ready that you are going to give the information into steps. Like first of all, then, finally. Okay. Are you getting me? So once you gather the information, you are making sure that you have understood it properly And when you are giving the information, you also should make sure that patient understands your information and patient is willing to follow your suggestions. Okay, so you should be ready in advance that this information I'm going to provide in steps. Okay, fine. And then resist the request for diagnosis. Now, this point says that resist the request for diagnosis, right? Okay, here I used false. I wrongly highlighted. This is about resist the request. So you should predict that you will have request from the parent. Okay, so wait for that request. Do not just keep on going. Don't make your communication monologue. Okay, so resist the request for what? For the diagnosis. So wait for the patient's parents' concern regarding the diagnosis. Okay, so you are predicting the response, so you will not need to go on like giving the like we discussed for the findings. Okay, so here you are going to resist the request, wait for the request. If patient doesn't ask you this question that whether my child has this diagnosis or what diagnosis my child has, if the interlocutor don't ask you, then it is your responsibility to prompt the interlocutor to speak on this task. Okay, like you may ask, do you have any other concerns? Okay, then he may raise the question on that, what is the diagnosis of my child then? Okay, so you should wait for this request, then you can resist the request, and it is very clearly mentioned that how you can resist. Okay, we cannot rudely do this, or our language should be very humble and polite. We cannot directly say that, no, it's not my role. Okay, you may say that I understand that symptoms are quite consistent with the asthma, but it is very difficult to diagnose asthma at a very young age, and therefore, doctor is the right person to talk on this topic. Okay, he will make the final diagnosis, as I have already mentioned. And I'm really sorry to say, but diagnosing is not within my scope of practice. So I hope you understand. Okay, so like this, you can give a very polite response to your parent or patient. Okay, then here the next point says find out any other questions or concerns. So this point is about finding out other concerns or questions. And if it is your task, the parent will definitely have the next concern. And what the concern will be, that you can assume based on your next play. Okay, this says that reassure parent about waiting time. So the parent will be concerned regarding the waiting time, right? So you can predict this in advance during your preparation time itself. Okay, how means what responses you are going to give is already mentioned for all the tasks. Isn't it amazing? Isn't it easy? Yeah. Establish parents' consent to return to waiting room. Yes, it is easy. Okay, how you are going to establish parents' consent to return to waiting room? Okay, will you say that uh, return to the waiting room? No, it's not an order. Okay, we need to request. Okay, would you please return to the waiting room? I'll call you soon when the turn of your daughter arrives. Okay, so we need to maintain the right tone, the right way of communication. Okay, so these all things you should do during your preparation time. You can underline the keywords. If you're giving computer-based test, you can highlight the keywords. Okay, when the patient responds, you need to listen very carefully because you may have certain responses which is not the part of your role play part. Okay, so you should be a very active listener and you should always approach the patient appropriately. When you begin the communication, be confident. Okay, this is the test, if you are confident, then you will be able to perform well. And you will be confident when you are prepared thoroughly. Okay, so when you begin, you will ask the question, then you will get the response from the patient. Now, what happens that generally students don't focus on the response, they just become engaged in preparing the next task. But it is not always mandatory that all the information will be in sequence. Okay, it may come in a random way. So you should be ready, and that is why highlighting only the keywords will help you a lot at that time. Okay, so you have to ask the question, then listen to your patient. Approach to the patient's concern. This is very important area. You cannot neglect your patient. Okay. So ask the question, listen, approach that particular concern, and then you move to your next bullet point. Okay. So don't rush. Okay. Just go with the pace, your natural pace. Okay. And slowly and gradually, with practice, you can be prepared for your exam. Now, here one last time, I would say that you see one more time that what all things I have highlighted. Okay, like you are talking to the parent, 3-year-old girl in emergency department with chest tightness, wheezing, difficulty breathing, assessing in track, just taken vital signs, child is not present. Okay, I understood the whole scenario based on the highlighted words only. Okay, here you are asking more information about symptoms. This point is about further relevant details about the child's general health. This is about examination findings. This is about the next steps. This is about resisting the request, refusing the request. This is about finding out the other concerns. This is about reassuring the patient about the waiting time and taking parents' consent to the returning to the waiting room. So highlight only the keyword. Suppose if the interlocutor jumps from this bullet point to directly diagnosis, you will come to know instantly. Okay, that this is not this connection, this is here. So either you can cover this part, you can respond to that particular bullet point, or you may say that we will definitely talk on the diagnosis, but let's now discuss on the more symptoms of your child. Okay, it's totally up to you how you manage, but you are giving appropriate response is very, very important. So I hope this video is very helpful to you to prepare for your task. And if it is so, you will need to, subscribe to my channel. And yes, in the beginning, I said that if you really need to have the transcript of this task, then you will need to write your email ID into the comment box below so that I can share my PDF of this task with you. And if you really like me to make more videos, please suggest me into the comment box. I'll try my best to have the next video of your choice. So stay tuned with me, and I hope this is very important. See you next time. Bye bye.